best treatment option for penile pain that you have not tried from biomechanical perspective is the one that I'm going to show you in this video. But before I start, I want to tell you something that you got to pay close attention to. When it comes to, in the absence of STDs or UTIs, it is the stability of your pelvis that needs to be looked at. Even if you have tightness inside your pelvis, the question you want to ask is, why is it tight? Not what incident caused the tightness, but how did that incident cause tightness? And so when you think about it, when you start investigating and chasing after the whys, you'll see that the response of the muscles inside your pelvis is directly related to what's happening too much of or not enough on the outside. So if your pelvis is stable, the muscles inside your pelvis do not have a reason to be tight or weak. When it comes to penile sensitivity, it is the tightness typically that causes the issue. So in this video, I'm going to show you some of the exercises that I do with my patients that I see with those symptoms, meaning penile sensitivity or itchiness, but the reality is that's part of the history taking. But because when I looked into the cause, I see that it is purely biomechanical. The good news is no one is going to be going through the anus to address the tightness inside the pelvis in the approach that I have with my patients. In this video, I'm going to show you 3 exercises. One is very basic, but you gotta have it. You can't go to the second level when you don't have the basic level. And don't tell me you have it, meaning you got that down, because I'm telling you, you don't have it down. I'm going to, at the end of this video, I'm going to put a video on how to breathe biologically. I know you think you got that one down too. And I know you're thinking, well, why am I doing breathing if it's my penis? But the reality is that that's a whole different video on why that is. I'm not gonna make this video, I'm not gonna digress here, but let's just say you need to have the breathing down. That's the foundation to everything else that you do, period. The second thing that you want to have is a neutral spine. Neutral spine means your body is capable, your front of your body and the back part of your body are capable of sandwiching and supporting your trunk. Your trunk is this rectangle, your torso is this rectangle. And what has to happen is between the front of your body, back of your body, and the sides of your body, it needs to be fully stabilized. The stability of that translates into a better connection to the pelvis from the top end. So it's gonna look like this. You're gonna lay down on your back with your arms up in this position. If you have a hard time opening up your arms, that just means you have not been doing your exercises correctly. You have too much of a forward flexion of your shoulders, too active of your pecs. So if that's the case, you can place your hands here. In my case, I'm going to continue doing it the right way. You want to close the gap in the small of your back. That does not mean you shove your legs into the socket to tilt the pelvis up. It certainly doesn't mean you squeeze your butt to shove the pelvis up here, just pushing it up. So what you want to do is you want to use the lower portion of your abdominal or your trunk, your torso, to slowly shift and bring the whole front portion of your pelvis up towards your belly button. If you're engaging your butt at the very beginning of this move, you're doing it incorrectly, just to give you a clue here. So once that gap is closed, your job is to keep that gap closed as you bring one leg up with your ankles flexed. Make sure your knees outward, Then breathe in, push your sides out. Make sure you watch that video at the end and bring the other leg up. You don't want your torso to be moving. So in the process of bringing it up, if you go down, you did it incorrectly. If you bring it up and your whole body just shifts down, which I can't do, but if it shifts down the whole body, not just the pelvis, you are doing that incorrectly too. So you want to make sure that your abdominal diaphragm is nicely snugged against the floor. Your pelvis, that gap is closed, and now I can bring this up. Now your job is to hold this position with the gap closed. Your legs are outward, your ankles are flexed, and you just hold it up. Most likely, you're going to notice that your legs get very tired very fast, which goes to show you how much of your stamina in your legs were being provided by the wrong part of your body. And that is contributing to this lack of stability of your trunk over your pelvis, and that is contributing to your symptoms. The next exercise I like is starts from here, only this time my shoulder and my lower quadrant, not just the leg connected to the pelvis, but the whole quadrant. So if I cut myself into 4 sections, my upper quadrant and my lower quadrant together will go away from the camera. You need to make sure your back is not arched, so it's still elongated, so you're keeping that neutral spine. And you slowly, controllably go towards the center, and then you do it on the other side. Make sure you do not lead with the leg or arm, but the sides are going. So pretend you don't have any arms and legs. How would you go from side to side? That's the key. The last one that I really like is really working on the hip joint and mobility of the hip joint in this movement. So what you want to do is you want to keep your spine nice and neutral. So you sit exactly the way I'm sitting, and what you want to do is you want to go up and back and up and back. So the question is, can you go up, or are you going to have to lean forward to go up? Or are you going to be using your shoulders to go up? All of those are showing you what you're using instead of your legs and your butt in this movement. It goes to show you how dysfunctionally you've been moving all along, and how much these muscles inside your pelvis have been putting up with so much imbalance. So for you to think, oh, not a problem, I'm just going to do this one exercise and get rid of this problem, you are mistaken. I know that's not the answer you want to hear, but that's the reality. That's the challenge that I, as a rehab provider, have with my patients in general. Because if you see the depth of the issue that you're coming up with, then you have more compassion towards your body and what it takes for it to heal. By the way, these exercises are just not for men because they have, I don't know, penile sensitivity. These are for functional mobility. So if you came to my office with hip issues, or you came in with lower back issues, it's still the same answers. It's all about proper mobility. If this makes sense, please write in the comment. Make sure you subscribe and take care of your problems before they become huge. Thanks for watching.